So, friends, good morning. And today I'm going to talk about one of the most important aspect of the back pain. And I'm going to talk this in perspective of mechanical back pain, not the pathological back pain. Yeah, so both of these are interconnected. But uh, today, the exercise I'm going to talk about is in relation to the mechanical aspect of the back pain, right? So there is one very basic exercise which every one of us, even physical therapists and orthopedicians, they do recommend this exercise for back pain, and this is known as extension exercise, extension of the back, और हम इसे हिंदी में भुजंग आसन के नाम पे भी जानते हैं. So in most of the case scenarios when we approach any professional with the back pain, they say that you need to lie down on your back and you need to extend your back, right? So for you, I'm gonna put the picture of that specific exercise over here, right? Now, this extension exercise, it can be good in certain cases, right? But in most of the cases of back pain, this exercise will lead to more harm than rather any good to you, right? So I'm gonna explain this to you with the help of this anatomical model, right? So I have this pelvis model in front of me, fine. So you can see this is L4, L5 and sacral vertebrae. ये आपका pelvis है. And this specific joint, this is known as SI joint or sacroiliac joint. This joint is responsible like for connection of upper body with the lower body, right? And this joint is having certain play or certain ranges of motion, right? So normally in a body, this SI joint, this needs to have relative motion like this. So like when your pelvis comes forward, the sacrum goes backwards. And if it goes backward, the lordosis of your back or the curvature of your back decreases. If your pelvis it goes backward, the sacrum bone it tilts forward and it leads to increase in the curvature of the body. Right. But what happens in certain cases is that uh, due to certain reasons, one of which might be gaining the range of motion at hip joint or at knee or at foot or even above the body. So to gain these certain ranges of motion, the pelvis it dumps forward. It dumps forward like this. So now what happens is that when it gets dumped forward, the hip joint it gains the range of motion which it was lacking, right? But because of this dumping forward of the pelvis, the relative motion between the SI joint it is lost. So now what happens is instead of doing this and this, the pelvis it moves as a whole. Right. Now you can also see if there is a relative motion between the SI joint, there is also spinal movement, right? You can see the segments of the spine are rotating. But if the pelvis moves as a whole, there is no rotation between the spinal segments and the lower spinal segments, the lumbar spinal segments, they get fixed or you can say they lose their mobility. And mobility at lumbar spine is very important. Also, because of dumping forward of the pelvis, the lordosis of the lumbar spine it increases. Right. So now you can imagine that when we do a extension exercise, we also increases the curvature of the lumbar spine. Right. So say a person is having a back pain and the reason behind that specific back pain was dumping forward of the pelvis. Right. The pelvis is forward. There is increased lordosis. And due to increase in lordosis, you can see these are the facet joints. These joints are the joints which attach one segment of the spine to other, one vertebrae of the spine to other. So when there is extension in the spine, there is increased pressure at these facet joints, right? Because they keep on approximating themselves and there is increase in pressure at these facet joints. Now, if we further recommend a patient to do the extension exercise, what will happen? There will be facet joint arthropathy because there will be more than normal pressure at the facet joints, right? And moreover, overextension can also sometimes lead to disc bulges, right? So as of now, we know that if a patient is coming and the patient is having a disc bulge, we ask the patient to do the extension exercise. And yes, sometimes the exercise is beneficial to the patient. But if In that specific patient, the pelvis is slumped forward, and we keep on asking the patient to do the extension. We might like gain some benefit in the radiculopathy, but sooner or later, the patient is going to have facet joint arthropathy, and the pain won't go away then. Moreover, the extension exercise, it leads to isometric contraction of the back muscles, right? So there is already a compression present over here, and if we keep on doing the extension exercise, we keep on approximating the muscles, which will further increase the pressure on the lumbar spine, and which will further dump the pelvis forward. So sooner or later, this increased lordosis will also lead to increase in kyphosis and forward neck posture. So I humbly request all the patients and all the doctors that before doing extension exercises, go to your physical therapist who is well aware of all the biomechanical dysfunctions of the body, who are well aware that how the body works biomechanically. Only go to them and get your exercises recommended, and then follow that specific exercise pattern. And then you're going to be relieved of your back pain. Thank you.